Hi, I'm Dr. Shauna Pittman, clinical pharmacist, coming back to you today with another video for my pharmacy technician students. I want to just start with a brief intro. I've been a clinical pharmacist for 30 years. My passion is to work within the healthcare system to try to improve the experience of healthcare overall. I work by empowering and educating patients to be partners in their healthcare and also to model empathy and understanding of patients to my healthcare peers. So getting started today, I'm going to continue a lesson that I was doing in class this past Wednesday. This is module 12, picking up in lesson 3, the cardiovascular drugs. This is not meant to be comprehensive by any stretch. Just a brief review, and I'd like to add some important principles to the material that's already presented to you. First of all the cardiovascular drugs, there's a lot of overlap between medications used for different conditions. An example is you might see a drug that's used to treat blood pressure, and also in the same patient might be treating their symptoms of congestive heart failure, or a drug that is a diuretic that is helping their symptoms of congestive heart failure, their blood pressure, and perhaps their kidney function. So it's common to see overlap of these drugs. Sometimes 2 or 3 medications might be used to treat blood pressure. And what happens is you will see a therapeutic duplication or a message that comes up in the pharmacy system that is flagging our attention to that situation. The pharmacist has to review that and decide if the computer's caution or warning is valid for that patient. Oftentimes, if the patient is continuing the same regimen, then we don't have to check with the doctor or make any changes. But if a patient has a new cardiovascular drug added, or a drug stopped from the regimen, or a dose is increased or decreased, we want to review that carefully because it can change the balance of their hemodynamics and how their heart and their vasculature respond overall. And so one of the ways that patients can be very involved in their healthcare is by doing home blood pressure monitoring. And I highly encourage this in all of my patients that have been told they might be developing hypertension or they are hypertensive. It's very simple to do. I teach a community class on this topic to give patients the education about why it's so important to manage the blood pressure and how to do it. But if you think about it, when a patient goes into a doctor's office, it's not an ideal situation to measure their blood pressure. Perhaps they've just driven through traffic, they've been waiting in the waiting room, they finally get called back by the medical assistant, so they pick up their goods, they go back, plop down in the chair, they're getting their pulse ox, their temperature done, the assistant is watching the respirations, and the machine is taking their blood pressure all at once. As soon as the thermometer's out of their mouth, they're, asking, how much do you weigh, and what are you here for today? And so it's not the ideal situation that's recommended, where a patient be seated at rest for about 5 minutes before their blood pressure is checked, with their upper arm at heart level and their both feet flat on the floor. And there are a lot of other specifications that can affect blood pressure. We don't want the patient to be talking, for example. So all of these things are key. And that one spot reading in the doctor's office is perhaps not indicative of how their blood pressure has been at home. When they monitor it at home, they can keep track of their blood pressure readings. I suggest twice a day, and to find 2 routine times during the day. such as in the morning when you're having your breakfast and first cup of coffee, and then perhaps in the evening when you're watching news or checking email. And even though the machines will record the blood pressure numbers that you can review through the machine and show the doctor later, I recommend that a patient use either just a piece of paper to write down the readings or to use one of the medical apps where you can track your own healthcare progress. And the reason is it gives you the opportunity to record other things that may be going on during that time, such as if you're fighting off a cold, or if it was a very stressful day for some reason, or if one of your medication doses has changed up or down. And so you can track this information along with it. Then when the patient brings that information into the doctor's office, the doctor can make a more informed decision about how to perhaps adjust the blood pressure medication based on more information of what the patient's blood pressure is when they're actually going about their daily activities in their home environment. So I always recommend that. A simple automated blood pressure machine that works on the upper arm is what is recommended.